The following program contains mature subject matter. Viewer discretion is advised.
This is 15 minutes of fame that no man wants, making international headlines after your lover chops off your penis. When a woman found out her man was to marry another, she made his private parts a public news story. But there's a silver lining. Surgeons were able to successfully reattach his genitals. But you might wonder, how is that even possible? To help us answer that question is urologist and the author of a book that I think could get really big, the penis book, Dr. Spitz.
I appreciate you guys stroking me, really, I do. Thank you. But let's get down to the...
But you, so back to penile reattachment.
Yes.
You've had some experience with a case or cases like this.
Yeah, professional experience, yes, right. So when I was at LA County Hospital training, you know, pretty much anything and everything that's out there comes in the door. I think
yes.
You remember that. And unfortunately, this mentally ill person self-inflicted this injury on himself, driven by, you know, voices in his head. Very tragic, and you know, the majority of these are as a result of mental illness. But he came in, had severed his own penis off, and we were able to reattach it. It involves bringing the major structures together, the urethra, the P channel, the two chambers that fill up with blood, that give the erection, and then, of course, the nerves that allow for the sensitivity. And all of that is done over a pretty long and meticulous operation.
No, I know there aren't a ton of studies on this, but what are the likelihood or chances after a reattachment surgery that you could go on to have normal erections, normal arousal, normal sensation?
Right. Well, remarkably, it is possible. Now, it's not possible in all cases, but in about 2/3 of cases, it actually is successful. And this gentleman was successfully restored. Unfortunately, as you know, happy as we were with the outcome, a year later, the same man came back in the ER with the same self-inflicted injury, and we put it back on again.
And what you were mentioning is the cleanser syndrome. It's that very rare psychological illness, actually, where somebody has these delusions. They're kind of called command hallucinations, where they're telling them to hurt themselves. And sometimes it's a limb, sometimes they take out an eye. Oftentimes it can also involve genitals. And so it sounds like his underlying mental illness was probably not treated, and so he probably had the same command hallucination again.